There are few real conservatives these days. They're generally globalists in some form or other, and inimical to U.S. national economic interests. Even if they are morally conservative, politics is preponderantly more about economics than morals, all things being equal, and excluding the Genghis Khans and Joseph Mengeles and so forth, which should be something more of a personal area that flows upward to the people collectively. One may wonder if conservatism in the United States has evolved to mean economic existentialism and collapse of social realism as a political concern. With leaders that believe there are no consequences to group behavior economically, environmentally, or politically, the result is soundbite talk show quality candidates with no comprehension of the world today or America's role in it. Newt Gingrich is sort of a co-founder of the 90s economic infrastructure corruption that is paying off now. He did, of course, have a lot of support. Obamacare is a costly trick for corporatism. Obamacare requirements that all citizens purchase health insurance is a fundamental corruption of the role and relationship of government to the citizens. The U.S. government may serve to provide free health services as a safety net for the people, yet it cannot decree that the citizens should pay money for services to other citizens, groups of citizens, such as businesses, through law. U.S. courts may, of course, find in civil suits between individuals on monetary issues, as the case may be. The creation of health insurance exchanges that poor individuals are required to use to buy insurance from or from any other source is simply a trespass by the federal government on the fundamental right of the citizens to be free from bills of attainder and control in their empirical lives. It is more of a violation of privacy than any abortion theorist might ever advance in its support. The notion has been advanced that expanding the insurance risk pool would lower health care costs for the middle class. That may be true, yet that is a financial context that the government has zero right to engage in. If the middle class wants lower health care costs or emergency medical services for those that have used up their insurance benefits, it should reasonably create a free public health service for the poor, veterans, and those that have no other recourse for their medical condition. Removing the incidental costs of providing health coverage for the uninsured would itself lower the overall health care costs of the United States if all of their economic factors were favorable. If the middle class wants to have $1 million worth of health care insurance apiece and wants to pay for it by conscripting the healthy uninsured youth of the nation into a mandatory insurance risk pool, creating thereby greater profits for the corporate insurers, they would still have no assurance that the corporate profits would not just flow up to CEOs taking tens of millions of dollars of stock options. Neither would the youth have a significant chunk of their paychecks if they are employed someday for services they don't use. As a matter of logic, it makes little sense to remove capital from the poor and the middle class and make them pay corporations, thereby eroding the potential for business development and savings, investments, and so forth in the long run for the poor and middle class. When the corporate world began to eliminate the employee health insurance programs, it began the progression toward the day when all American citizens would instead be required to pay them for insurance by law. As the leadership of the Democratic Party has vacated its traditional concern for health coverage universally for the poor and failed to make rigorous income standards for Social Security that would not pay those in retirement more than the average working American, it has become fiscally irresponsible to